Hi, I'm Michael Safir. I'm a board-certified reconstructive urologist at Align Surgical's LA office, and I'm pleased to introduce Brianna Jedrzejewski, who is a reconstructive plastic surgeon at our office in San Francisco. And I thank you all for joining us this evening. We are going to turn off the comments just to avoid any potentially harmful commentary, but you should feel free at any point during this to type in your questions to the question function. We'll leave some time at the end to answer a few audience questions. And with that, let's dive in. This is Instagram Live, so anything could happen. I really want to get Dr. Jedrzejewski's feelings about this topic of surgical regret, but maybe we can take a few moments, Brianna, just to tell everyone who you are, why you're doing gender surgery, and then maybe just a little bit about the important study that you did addressing regret.
Sure. Thank you so much for the introduction. My name is Brianna Jedrzejewski, and yeah, I just started with Align Surgical Associates earlier this year. I graduated from Oregon Health and Science University, completing plastic and reconstructive surgery residency there. I'm originally from California, and I've always had an interest in social justice. And so as I moved through my trajectory in surgery, I found that in plastic surgery, any kind of reconstructive surgeon deals with a lot of revision of trauma, whether it's physical, emotional. They're kind of tied together. And so that's what drew me to plastic surgery. And I was fortunate to train at a high volume center for gender-affirming surgery in Portland, Oregon. And that really led me to pursue this field.
Yeah, that's great. You know, as surgeons, we love to talk about the surgery that we do and how it's done and the nuances and the improvements we're making. But I think it's also, wonderful and commendable that you were involved in research regarding surgical regret, since I think it's important to dispel any ideas that regret is a very common outcome of the surgery that we do. And maybe you could tell us a little bit about how common regret is and what we're really talking about when we're talking about regret. Or I wish I never had this surgery, I wish I never went down this path, or I've had kind of a hard time recovering from a complex operation. So maybe just give us a little bit of insight.
Sure. So as you said, regret is a really complicated idea, emotion, concept to kind of wrap our minds around. I think, you know, at the core, it's a highly negative feeling where one wishes that the outcome wasn't as it is, right? And so when we talk about regret for surgery, you could be talking about negative feelings of pain after the operation, maybe of complications of how the surgery turned out in the end, whether that's functional or aesthetic. You could be talking about how you didn't have the appropriate support after surgery. Maybe you recovered alone and it was difficult, and maybe you regret the timing of that surgery. So those are all concepts, you know, no matter what surgery someone undergoes, that can involve regret. And I think in gender-affirming surgery, there's a lot of attention placed on detransitioning, and do patients undergo a surgery that they then, you know, can't reverse the results of, and what's the percentage of patients who encounter that after gender-affirming surgery. And so I was lucky to be part of a work group in Oregon who looked at 6 years of surgeries, of gender-affirming surgeries from 2016 to 2021. It included 1,989 patients, almost 2,000 patients, and looked over that period of time, which included 2,863 procedures, because of course many patients get more than one procedure for gender affirming surgery if they decide to go down the route of surgical intervention. And we found that 6 individuals, so 0.3%, less than 1% of patients who underwent gender affirming surgery at our single institution requested reversal surgery or transitioned otherwise to the sex assigned at birth. So those are quite encouraging data that shows that the vast majority of patients do not regret gender affirming surgery.
Yeah. So how would you say, I know that you have particular knowledge about how rates of regret with regard to gender affirming operations compares with other elective procedures unrelated to gender. Like, can you give us a little bit of insight into things?
Sure. Well, I think that when you're looking at different kinds of elective non-cosmetic surgeries, for example, knee surgery, elective knee surgery, the rate of regret for elective knee surgery in the literature is anywhere from 10 to 20%. So given that gender affirming surgery has what we know in this particular study, which presents a rate that's similar to what is existing in the current literature, less than 1% is extremely low. And if you think about how individuals approach gender affirming surgery, no one can just show up to a surgeon's office, knock on the door, and say, I want to sign up for surgery. It's a process that takes at least a year of living in your chosen gender before embarking on surgical intervention. Whether that journey includes hormones or not, it takes a long time, and the involvement of mental health professionals before someone can undergo gender affirming surgery. So another surgery that's not related to gender, like bariatric surgery, those patients undergo counseling for up to a year prior to surgery. And you'll find that those patients also have quite a low rate of regret of about 2%. So I would venture to say that it's probably because these patients undergo, so much preparation to undergo these procedures that the regret rate is so low.
Yeah. Yeah, your point about the education they get is really important. And, for example, there's a patient I saw last week who came and wanted surgery as soon as possible, and had not sought out counseling from mental health providers, was not on hormonal therapy, really knew very little about the operation. And so, this is a patient that in the early parts of screening, we might say, look, the surgery may be in your future, but there's a lot of preparation you need for us to feel comfortable moving forward. And then also, having a multidisciplinary approach, the letters that mental health providers give us to help us make decisions about surgery, sometimes they're very illuminating, and illuminating in a direction that dissuades us from proceeding with surgery at this point. And so, also I think it's to dispel the idea that we rubber stamp things, that we just, check all the boxes and then patients go on to surgery. This is a long process. Patients typically have multiple operations, have, tremendous amount of education. And so I think I agree with you. I think that's why our operations have relatively low regret, and why other operations like bariatric surgery, because of the educational component, patients patients are well informed and generally happy. The other thing is, dissatisfaction with one element of the surgery is really different than someone's desire to detransition. And when people talk about regret, what immediately comes to mind is detransitioning, and that isn't necessarily, all encompassing for the word regret, right? Don't you think?
Yeah, I agree. I think people conflate those words. Regret, you can regret the timing of something or the nature of something, or maybe even the type of procedure you underwent, but it doesn't necessarily mean that you wouldn't do it again. If someone asks you, like, would you do that surgery again? I think that regret is multifaceted, as we spoke about earlier, and you can have different types of regrets. So you can have that true gender-related regret, which you mentioned, which is very, very rare, given how long people live in their desired gender and kind of the education that they undergo prior to surgery. There can be social regret after surgery. There are serious repercussions in society for, presenting as trans or gender diverse. And sometimes, people lose jobs, relationships, status after undergoing gender-affirming surgery. And those can be, life-altering events that people could regret. The repercussions of having surgery. And that doesn't necessarily mean that they, wish that they detransitioned in a true gender aspect. And then, of course, complications. So no surgeries without risk. And some surgeries, we want every surgery to go as well as possible and perfectly, but that's just not the way that things work. Every patient has their own ability to heal. Every surgery has its own set of, obstacles to get through. And I think that, you could regret a complication that you have after surgery but still be happy that you underwent the surgery.
Yeah, when I started doing the surgery back in 2017, I don't know that I was initially prepared for patients right after surgery having some negative feelings. And I thought just, they've been waiting for this operation for so many years that immediately the next day, they're just going to be so happy. But I think sometimes the reality of recovering from a big operation, you have the fantasy of what's in your future, and we try as hard as we can to get patients there, but that road to ultimate satisfaction sometimes detours. I'm having pain after surgery, or I'm not getting the support that I should, or some members of my family that were not supportive are getting in touch with me and saying, why did I have the surgery? And those I think are real things. And our patients are tough, right? I have so much admiration and respect for our patients, but those feelings creep in after surgery. And like anything else, you're like, oh, I didn't know this was going to hurt, and I'm having a lot of swelling, or this changed. Is that normal? And just fear of change, no matter how positive you things are going to end up for you. The path is not always direct, right? And don't you agree? Or
Yeah, absolutely. I think that I've also had the privilege of seeing, patients that wake up, in tears because they're so happy after surgery, which is a beautiful thing and an emotional thing. And I've also seen patients that night, once that long-lasting numbing medication wears off, being very upset and questioning whether they should have gone through the surgery or not. Thankfully, in my experience, those patients, are in the end happy that they've gone through surgery, and it's highly correlated to the pain and discomfort that they have. And everyone has a different level of pain and discomfort and different coping mechanisms. But I think that, if you have dysphoria about an area of your body, then you have surgery on that area, then suddenly you have all this physical pain that's aggravating, your emotions about the entire process, I think. And I think that there's no linear path, right, of realizing your embodiment goals. I think that, it's not just a linear path after surgery. There are, steps forward and steps back, depending on how recovery goes.
Yeah. And I think what sometimes doesn't come out is that we use the patient experience afterwards, after taking care of many, many patients. We begin to look at how we are delivering care and making sure that we are preparing patients for some of the downtimes they might experience. If we think we need to do better with pain relief, or institute new methods or techniques of pain relief, it's not just like, you're going to have a lot of pain, you just have to endure that. When patients have a hard time, a complication, an unexpected outcome, we sort of dig in deep. And especially like our group, we meet every couple of weeks to talk about difficult cases and what we do to enhance outcomes, enhance the patient experience. And so, this is a really dynamic process that I hope will limit short-term negative feelings, with regard to recovery. Plus, I think regret is less likely when outcomes are better. And so all of the things that we do to support better outcomes, to learn from each other, to stay attuned to advances in surgery and help participate in those changes. I think that, this is a dynamic field in its relative infancy. And so we're doing what we can to improve the patient experience.
Exactly. I think the most important thing is to support patients, right? So however they may be feeling, it's important for us to support them, hold space for them. If they're having these feelings of regret after surgery, it's okay. We shouldn't take it personally. There's no need to get defensive. This is kind of part of the process. And so I think that really, the more that we can let patients know that regret exists in all these different forms, and just to be prepared for it. I don't think there's any way we can fully eliminate it, because it's hard to know how you're going to feel after surgery until you have surgery, right? But if we can, support patient autonomy and minimize mental health distress throughout the process, then I think that that's our responsibility, as providers.
Yeah. It's something that we are chipping away at, and we look to our patients for some guidance. And I do think the care that we provide for patients is much better than it was even 3 or 4 years ago. And I think it's great when surgeons like yourself devote themselves to topics like regret. Again, we love talking about how we improve technical aspects of the surgery, but I think to dive into an issue that our opposition uses as ammunition, to dive into that and really look at regret and say, whatever, wherever the evidence leads us, we're going to report what outcomes are. If patients have a lot of regret or a little regret, we're going to let people know. Obviously, we're really elated that the outcomes of the study support what we're doing, and generalized happiness with the outcomes of the surgery. But I think, again, I think it's helpful for patients to understand that we dig into the hard topics, and we get granular with issues that we'd rather not consistently think about, like regret. But so I think it's wonderful that that this study is out there, and I think hopefully it's going to help patients, families, other members of the team, and I think importantly the general public to really understand that regret is not detransitioning. Regret can mean very many things to different people, and that we're sensitive to assuring that we're only doing surgery on patients who are likely to be happy with the outcome of their surgery, and that we are not rubber stamping things when patients come to us for surgery. We're sometimes delaying surgery, we're sometimes not offering surgery, or at least helping to identify a preoperative path that's going to generate more success for that patient. That involves our multidisciplinary team, that involves education. Yeah, I think it's wonderful, and I think it's a great topic, and I'm really happy that we're talking about this.
Well, thank you so much. I mean, I hope that this study inspires further studies. I think that the more feedback we can get from patients, the better, and how we can incorporate that into, improving systems in the work that we do. I think that, unfortunately, for some people, even presented with this data, some people choose not to listen or choose to kind of find flaws. But I think that, I hope that this helps patients feel heard, because I think this is something that our patients have known for a long time, that the rate of regret is low. But yeah, now that I'm glad that we can, include it in the scientific literature. So I want to just look and see if we have any questions here. I have one that says, do you think hormone therapy is required for gender-affirming surgery? And no, I don't think that it's required gender-affirming surgery. I know that in terms of insurance coverage in the past, that was one of the recommendations or requirements, that patients were on hormones for up to a year, or at least a year before surgery. But, thankfully the field has evolved in its understanding of non-binary gender. And sometimes hormones are not part of an individual's plan. And so it shouldn't be a requirement or a barrier to surgery.
Yeah, I agree with that. I think for many of our non-binary patients, I think that there are patients who just simply don't have that as part of their transition process, and they're no less committed to the surgical changes than patients who are on hormonal therapy.
Exactly. And I think that, that's one thing that can help reduce regret in the future, is removing obstacles for non-binary individuals, which is happening.
Yeah, I think that reducing roadblocks is important. I think the idea that patients had to be on hormonal therapy, that somehow that made them more primed for surgery, or that it was an indication of their commitment to surgery. There's some patients who go on hormones and don't like it.
Yeah.
There's some patients who go on hormones and it feeds their dysphoria rather than improves it. Or there are patients who have medical reasons why they can't go on hormonal therapy. And I think to restrict access to care for those patients, I think is a bad idea. So I think that was a good question about hormones. So I'm happy it got asked.
I think hormones definitely have their place, and if they're part of someone's surgical, if they're part of someone's gender expression, then it's best to wait a year after starting hormones in terms of if someone's having a breast augmentation, for example, because we see the majority of breast development after a year of being on estrogen. So that just helps optimize, a patient's outcome so that we aren't subject to asymmetries later on after an augmentation with breast growth that we weren't expecting in certain areas.
Great.
Yeah.
Okay. Do we have other questions that are popping
No,
up?
I don't see any other questions just now.
So maybe Brianna, like, how do you, someone who's not on board with gender surgery, someone who doesn't understand it or has a political or religious opposition to it. I mean, how do we use this information to try to educate people who are not necessarily receptive? I mean, some people will never listen, but I guess it's our hope that patients who, or the public that uses science in making decisions will take information like this and at least become more accepting of family members or the general public who choose to make gender changes in their lives. How do we talk to people who like aren't our allies yet?
Yeah, I think that people respond well to comparisons that they can identify with, so I think that someone who's not receptive to gender affirming surgery but has had a knee surgery or has had some other elective surgery, and maybe has had feelings of regret about surgery, can then kind of relate to what we're talking about and maybe see if they appreciate the data for other surgeries, can appreciate that when comparing that it's quite low for gender affirming surgery. So that's why I use examples outside of gender affirming surgery, because I hope that it will invite people to be able to see this from someone else's perspective.
Yeah. Someone asked me what's the best way to think about this, and just the best way to think about it when you're addressing something that's happening in someone else's life is to say, this isn't about me, this is about them, right? And it isn't about your own biases, it's about understanding someone who doesn't have the same biases as you do. So I think that's a good way to approach things, Brianna. I think to try to just chip away at opposition to this, and I think this paper is going to be really helpful in a dialogue. I think we're almost out of time. I do want to plug our website, which is www.alignsurgical.com. There's a lot of important information on the site, a lot of educational content that we've tried to put forward, and I think it's a really good resource for patients, family members, the general public to learn a little bit more about the work that we do. We hope to have more of these Instagram live sessions, and keep on checking our Instagram page just to be aware of what the latest offerings are and what's going to be out there. We invite your questions. And great. Well, thanks, Brianna.
Thank you so much. This was a pleasure, and I hope that we were able to, inform some people about the great results of the study. So, thank you.
Thank you.